Right, so what do you do?
Okay, I'm a diagnostic radiographer, but I specialize in mammography. So at the moment, I work on breast screening, and what we do is to do mammograms on women between the age of 50 to 70, and what we're looking for is any subtle things that would not be felt by the women, so to diagnose if there's any inherent abnormality in their breast. And also we also do symptomatic patients, and these are patients that have had symptoms and they would have been to their GP and they are referred into what is called the one-stop clinic, and the rule is a 2 weeks waiting rule. So every patient that goes to their GP, they should be seen in a window of 2 weeks.
Okay. And how much experience have you had in mammography as a mammographer?
Almost 10 years now.
Yeah, and all 10 years have been in the UK?
Yes. I've been a qualified radiographer for over 25 years, but I've been a mammographer in the last 10.
Okay. Oh, that's very nice. Okay, so I'm just going to ask you a few questions in your experience, right? So in your experience, what is the toughest interview question that you've ever been asked as a mammographer?
I would say, one of the toughest questions I've been asked is at the end of the interview, they asked me, is there one question you've been prepared for and we didn't ask you? And at that point, I've come to the end of the interview, and I think I was just thrown off. I wasn't expecting that question, but she asked me, is there one question you prepared for and we didn't ask you? So I started thinking, I didn't want to shoot myself in the foot, because if I say a question and I can't remember it, so I would say that's the toughest question I've been asked.
I think that's very insightful. I don't think I've heard it being asked like that before. I've heard, is there any question you want to ask us?
Exactly.
But this is different because it's saying, did you prepare for something and we didn't ask you? You want to tell us about it.
Exactly.
That's very nice.
So at that point, I felt like I just said there was nothing, because I was thinking, if I go say something, they now ask me and I can't answer it well. Although I knew that might not have counted for them, iron me or not. But at that point, I wasn't expecting such questions. So I'll say that's the toughest.
Well, that's very, very insightful, really. So the next thing I'll ask you is, if you were on an interview panel, right, and you were recruiting new mammographers, right, what is one question that you would definitely ask them?
One of the questions I would say, that might be tricky, but one question I would want to know is, why do you want to do mammography? Because when it comes to every other imaging modality we do, mammography is very intimate, and there's a thin line between a woman telling you that you're molesting them and you're doing your job properly. So what I would ask a to-be mammographer, because we have two types of mammographer. There's people that come in as a training mammographer, and those are experienced mammographer. So if you were a training mammographer, one of the things I would ask them is, what do you think might be one difficulty if a woman came into your room and is refusing to have a mammogram? What are you going to do? Because they've already come in, and you ask yourself, why is she here if she doesn't want to do it? So what are you going to do? That would be my question to ask. Then the other one, if it's an experienced mammographer, one question I would ask them is, if a woman come into the room and asks you, I've read a lot about breast density, what does breast density have to do with screening or diagnosis of breast cancer?
Okay, that's very nice. Thank you for that. I think this would be very helpful to a lot of intending mammographers who want to get into the field, Okay, and then what is one piece of advice that you would give to someone who is preparing for their first mammography interview?
So I would say it depends on the role. If they were going into a breast screening, because we have, like I said, we have two types of mammography departments. Those are into breast screening and those are symptomatic. So if it's a breast screening role, I would say they need to understand the NHS BSP, that's the National Health Screening Breast Program. They need to understand the policy and the relevant training that is going on at the moment, whatever time they are going for. So they need to understand the policy at the moment. Then also, if it's a training role, I would say they just need to understand. But if it's a symptomatic, they might ask them, what is we have the rule, the 2 weeks rule, the 62-day rule. What are those policies?
62-day rule, yeah?
Yes, and the 2 weeks rule.
And the 2 weeks rule.
2 weeks waiting rule, yeah.
2 weeks waiting rule. All right, that's good. And then which interview question do you think that every mammography applicant should definitely be prepared for? That is hard to escape, in an interview.
Most interviews they might ask you what is the latest development or like research work that is going on. Because every time there's a trial going on, there's new research going on. What are the new policies? What are the changes to the mammography policy at the moment?
Yeah, that's very, very helpful. Thank you so much.